good afternoon, everyone. I'm Nancy Johnson. I'm the CEO of El Real Health, and we want to thank Sonora Quest for those congratulatory wishes on our 50th anniversary. We're really excited this afternoon to be here for this presentation that Health Current is supporting around Arizona's response to COVID-19. If you're like me, you've spent a lot of time talking about COVID-19 on a daily basis, maybe an hourly basis. And I'm very excited today because this panel really brings some diversity around the COVID response across the state of Arizona. So I'm going to introduce our panel members, and then we're going to get started and hear from each of them a little bit about the response to COVID in their part of the healthcare world. So first of all, with us, I have one of my new colleagues, Pedro, who's the CEO of Adelante Healthcare. And so another FQHC reporting in. It'll be interesting for me to hear his perspective on COVID. We have Dr. Jim Napoli, who's the Chief Medical Officer at Blue Cross Blue Shield. So we've got a great health plan representative and partner to hear from. Stephen Neal. I'm really looking forward to hearing from Stephen Neal because he is at Chinle and comprehensive healthcare facility in Chinle. So I'm curious to hear about the rural experience up there. Jessica Rigler is with us. She's the Assistant Director for Public Health Preparedness with the Arizona Department of Health Services, our fearless leader in many ways lately at ADHS. And then last, but certainly not least, is Jim Whitfill, who's also a physician. He's the Senior Vice President and the Chief Transformation Officer at Honor Health. So we have a really diverse panel today. We're excited to have time. So I'm going to get ready and get us going here. And we're going to start off with Pedro. And he's going to share with us just about Adelante Healthcare and what went on there when COVID hit in March.
Thank you, Nancy. As you mentioned, my name is Pedro. I'm the CEO of Adelante Healthcare. Proud to be a new member of the team. Just took over in July of 2020, and as you mentioned, a colleague of yours, and looking forward to just sharing the opportunity. Right, everyone in the audience today really are. I mean, in this day and age, we all have experienced COVID in our respective organizations in some way, some fashion, and really have a lot to offer. And so we're blessed to be here today and just be able to share our experiences. A little bit about Adelante Healthcare. We currently serve over 235,000 patient visits on an annual basis. Not as much as you all there in Rio. So we're about 75,000 patients, unique IDs that are coming through our clinics, with over 9 clinics that we have throughout the valley and in some of our rural areas. Early on, coming in, I had the benefit and to be a part of 2 systems. One, coming and experiencing what COVID has meant to us as an organization from a community development perspective as an executive with Chicanos por la Causa, and now as the CEO of Adelante Healthcare on the primary care side. And it really has been, quite impactful in regards to what it first looked like, for many of us in March. Many of us were trying to figure out what this pandemic was going to mean for us, what it was going to look like for our communities, the safety of our staff, our community members, our patients, our providers. And it really transformed us in such a way that is going to ever impact us as a community. Many of us have relied on technology more so than ever, switching to Zoom meetings and Teams and of course, relying on our partnerships with Health Current and gathering data and all the alerts that they've been able to provide for us as a provider unit, and really using that information and those data sets to really impact our communities. It has not been an easy ride, as you all know. Every week has offered new turns and twists throughout this pandemic. But together, our saying here in Adelante is, our staff say it daily. We are Adelante strong, and I know that as a community, we will continue to be strong with each other's, help and guidance. I know I'm going to turn it over to the rest to Nancy and introduce our colleagues, because I know we have a lot to talk about.
Thank you. That was a great way to start us off. And that's emotional to hear, because I know our staff here also were frightened. They were showing up for work, reaching out to the most vulnerable people, but I think the anxiety in the workforce, we were so concerned about a 50% drop in patient visits that, we
Yes.
forgot for a moment about our employees. So Jim, tell us what Blue Cross Blue Shield has experienced. And
Thank you. Still getting used to that mute button. I'm Jim Napoli. I'm the Chief Medical Officer for Blue Cross Blue Shield of Arizona. I've been with the company for 7 years. My background is in internal medicine, hospitalist, and I've been in the Arizona marketplace for now 20 years, either in care delivery or on the payer side. I would say, 2020 has really been an unusual year in so many ways due to the pandemic. We're now at more than 215,000 deaths related to COVID-19. So, this has really been an unprecedented event for most of us. And, during this time, we have remained committed to our members and focusing on them and ensuring that during this time, they're getting uninterrupted care when they need it. Data and technology have really played a key role in that. The data has really helped us identify and help manage members at risk. So those with chronic medical conditions and elderly people who are really at risk, being able to identify them through the data and then engaging them through coordinated care and just ensuring that their medical conditions remain managed and navigating them through this process has been key. Technology really has just been a huge enabler too as well. And we always knew that telehealth and virtual technology was, eventually going to really take off and provide, safe, reasonable access for both acute illness, chronic disease management. But we didn't, have any idea that the telehealth usage would increase by 2,000% across all lines of business essentially overnight. So when that happened in late February, it really provided a challenge and an opportunity. And so this huge uptake in telehealth has really been a massive part of the solution that we have seen throughout, the state of Arizona and frankly, nationally. And not only is it treating medical conditions, but what we've really seen is there are a lot of conditions related to behavioral health issues, anxiety and depression being, two of the top diagnoses that people are being seen for now on virtual visits. So being able to still have that kind of holistic view of the member and provide access in both mental and behavioral health has just been really a key tool used in helping with this pandemic. And then I look at the pandemic and all the kind of devastation, if you will, that it has caused. But if there's really a silver lining that we've seen in all this, it's really our awareness now of healthcare inequities and disparities that really is now coming to the forefront of what the plans are talking about. And as we look to the keys to addressing and mitigating all these disparities that we're now seeing in the data, it's really through addressing the social determinants of health. And the data is playing such a key role in identifying where these inequities exist in terms of zip code, health conditions. And as we kind of got together as Blues plans and looked across the country, we just see the disparities everywhere. 68% more type 2 diabetes in Black members compared to white. 29% higher delivery complications in Hispanic. So this just kind of goes on as we look at chronic conditions, behavioral health, maternal health. And so as the Health Information Exchange continues to do its work with social determinants of health, helps us understand that granularity and enables us to target our programs more, it really is going to help us build that capacity in key areas where we need prevention, treatment, and recovery. And so this increase in access and connections to care has really, really just been so very helpful. And it's going to help us cultivate those cross-sector partnerships to derive a collective impact on these populations. And ultimately, it's going to lead to better healthcare, better outcomes, and more sustainable care. So the work that we're doing today, in conjunction with the Health Information Exchange, will continue to essentially fuel the necessary data It'll keep things meaningful for us. So I'm really looking forward to the dialogue that we're going to have today about innovation technology and the continuation of our future partnerships, which will benefit the healthcare delivery systems in Arizona.
Yeah. Thank you. Go team. That was a really inspirational piece for us, and lots of questions came to my mind, but I'm going to hold on to those and keep our engagement around all panel members moving forward. So next we're going to pass it to Stephen, and Stephen Neal is Chief of Staff up in Chinle. I haven't been to Chinle for 2 decades.
It probably hasn't changed too much. It's still lovely. So you should come see the canyon sometime.
I need to.
I appreciate the ability to give a rural perspective from a federally operated Indian health facility. My name is Stephen Neal, as you mentioned, Nancy. Thank you for that introduction. I'm a PA in family practice, and I'm working on my master's in informatics. And I'm also the Chief of Staff for the Chinle Service Unit. So the Chinle Service Unit was hit as the majority of the Navajo Nation, but we were actually the epicenter of the COVID pandemic on the Navajo Nation. We had a couple sort of super spreader events nearby, and it was hit early and it was hit very hard. And thankfully things are continuing and we're coming out of the storm. And having the HIE set up was actually one of the things that helped get us through it. We had quite a few challenges along the way. And, as Dr. Napoli mentioned, there's been a few silver linings of this whole pandemic process. And one of those is, I would argue, other than telehealth, is just the broad adoption of technology across the board. I think there are going to be partnerships and just abilities for IHS in particular, but all of Arizona to grow and to sort of catapult 10 years. IHS has been known to be comfortable where it is. And the pandemic has sort of taught us that we have to adapt and evolve rapidly. Luckily in Chinle, we were already set up for that. And so we were able to provide quite a bit of support and assistance to the entire reservation for contact tracing and then setting up patient notifications with having an alternative data pool besides our own EHR, which, our EHR was helpful, but it kind of tells you what you already know for the most part. And so we had some really good examples of how that was valuable and useful. And I think you're going to hear everyone has sort of a consensus that the HIE and how we adapted to the pandemic and how we're going forward, it's kind of a win-win for everyone, especially patients in Arizona. So I'll go ahead and leave it with that. Thank you, Nancy. Nancy, I think you're still on mute.
I know if I do this for another 8 months, I'll probably remember to unmute myself on a regular basis. So thank you for that. I think that as you all mentioned so far about the silver linings, and I am continually thankful for all the emergency preparedness drilling that we do all the time, every year, a couple times, because it was great to see the staff kind of snap into place and know what they needed to do around workflow changes, closing sites, moving staff. It was just really a testimony to the emergency preparedness that our teams all work on. And don't hope for pandemics like this, but it certainly helped us. And with that, I'm going to turn the agenda over to Jessica to talk about the perspective from ADHS.
Thank you so much, Nancy. I appreciate that. And I'm really happy to be joining you all today to discuss sort of how we've partnered with the HIE for the statewide COVID-19 response and what that's looked like. And, we're a public health agency, and so our focus is really on the health of the state at a population level rather than any direct involvement in clinical care or patient care from state public health. Although due to the criticality of maintaining the health of our healthcare system in Arizona as a whole due to the significant burden of COVID-19, we certainly have engaged with healthcare partners in a more targeted way during this response than we have previously or than we typically do on a day-to-day basis beyond some of the reporting partnerships back and forth. So our public health system in Arizona, just very briefly, is broad. We've got the state health department, but there are also 15 county health departments and then multiple tribal health departments and tribal health agencies that support public health across the state. And we all work together. Specifically, when we look at communicable disease, we've got communicable disease data like COVID-19 surveillance data that gets shared amongst all those jurisdictions through a statewide electronic disease surveillance system that we all share. So we've all got a view into that system. And, as we've talked about already here, data is critical to drive decision-making and targeting interventions. And so we're really reliant on data quality, data timeliness, in order to make sure that we're doing the best that we can by the people of Arizona. I'm sure you're all aware that we collect and report a lot of data on COVID-19 on a daily basis now through a dashboard on our website, and we've been doing that for months. That data is coming from all over the place. We're getting it primarily through reporting from healthcare providers and laboratories, as we generally do with communicable disease data. We also get supplemental data that gets added into reported cases based on investigations that public health runs. So they'll interview a case and then they'll find out more information about that case to add into our database. All of that gets uploaded and reflected back to our dashboard. But one of the things that was really critical in this response is building on the previous work we've been doing with Health Current over all these years to partner with the healthcare systems in the state and utilize the data that Health Current already has to augment the data that we have reported in our systems from traditional sources. So I'm thinking about things like demographic data or hospitalization status on individual cases that really has improved our data completeness beyond what public health is able to gather. And that talks to Dr. Napoli's point about addressing identified health inequities. When we have more of that data and more robust demographic data, we're really able to do more things with that information and target the interventions that public health is doing or working with our partners that way. And then another data source that many of you in the healthcare system, I'm sure, are very familiar with is some required reporting requirements from hospitals and other healthcare facilities under enhanced surveillance advisories, which also gets posted on our data dashboard. So thinking about required reporting from inpatient facilities to help us identify the burden of COVID-19, like the number of inpatient or ICU or ventilated patients, what bed availability looks like, or occupancy. And we've worked with the HIE to support that reporting stream to create some interfaces so that we can reduce the burden of reporting. And I think that's a theme that many of you have felt that we've continued to work on. It's been a challenge and we've tried to overcome it to reduce the duplicative nature of reporting to the state and the federal government and everything in between. We've got a ways to go on that yet, but I think we're moving forward. And then just quickly, I'll note one of the really significant innovations in this response is the Arizona Surge Line, which ADHS stood up in partnership with healthcare facilities across the state to facilitate the interfacility transfer of patients during an emergency if there's a surge at a particular healthcare system. And it's really just such a hallmark of collaboration between the entire healthcare system in Arizona. It's a 24/7 toll-free line, and it allows clinicians to offer facility transfers to higher or lower levels of care if a patient needs something that's not available at the current facility in which they're hospitalized. And it's completely free to hospital providers and systems. But we were able to interface with the existing ADT feeds that HIE has, as well as Central Logic, which is a bed visibility program. So we could actually get real-time data from all the hospital systems throughout the state for this. And so we've got significant data now, about 85% of all bed capacity and 95% of all potential receiving beds in the state that are electronically interfaced with the Surge Line, thanks to this partnership. And we get status updates within 2 minutes of changes, which has allowed Arizona as a whole to transfer about 3,000 patients through this service, so that we can make sure that patients are getting the care they need at the right level, regardless of where they live. And we don't see one particular hospital or hospital system overwhelmed like we did in the early days of the pandemic in other states. So that's been pretty exciting. But I'll stop there with that high level overview of coordination. There's more that we've got in the works, certainly some challenges that we can talk about later, but I'll take a pause and turn it back to Nancy. Thank you.
That's great, Jessica. I learned a lot from that short piece, particularly just the use of that real-time data and how that was impacting surge. That's awesome work by everybody. So last but not least, Jim, I keep saying that, Honor Health. And Jim's also a physician and senior VP at Honor Health.
Thanks, Nancy. It's really great to be here. And, I think that this is going to be one of those years. If you're in healthcare, most of us have known about the potential for a pandemic for a long time. And I think most of us really hoped that we'd never see it in our lifetime. And yet reality became very clear. For us at Honor Health, back in January was our first sort of wake-up call when There was a local student that had an exposure. They come over from China. And I like to think about our experience with COVID as almost coming like three pebbles being thrown into a pond. First, a very small pebble back in January where we had the first patient show up in our emergency department with an exposure. And while everyone had been hearing about things in the news, it seemed like really far away. And all of a sudden we realized we needed to start getting ready for something that, while we had talked about being ready for, there was a big change in what we needed to do. We started making a lot of preparations in the background, and things were pretty quiet in the end of January, beginning of February. And then the next pebble sort of hit the water in end of February, March. I think all of us remember those days when literally borders were being closed with other countries. I think, like you all, we switched as everybody. Not only did we send all of our employees home to start working remotely where they could, obviously our clinical staff needed to be up on the front lines, but at the same time, we needed to change our delivery mechanisms. Dr. Napoli mentioned, we switched from doing all inpatient visits. I remember the Tuesday when Monday there were inpatient visits, Tuesday there were none. We did everything by telephone. And within about 2.5 weeks, we had gone through 3 different telehealth video trials in order to move the entire Honor Health medical group into that space. And it was hard. It was a ton of work, and it was not perfect, but it was the fastest digital transformation I've ever seen in my life. We did years of work in days. And that was both terrifying and it was exhilarating, because as a physician and as an informatics person, I know that there's a lot we can do with this technology, but there had always been a number of barriers. And then there was the big, really what I call the rock hitting the pond in the summer. And that was, Honor Health as a local not-for-profit system here in Maricopa County. I think we're the last local organization left. For us, we certainly see a service to our immediate community, but all of a sudden the community that we were serving became a lot larger. And we've actually grown much closer to our colleagues up in the Navajo Nation. We've had them join us for ground rounds. We had, as Jessica mentioned, a large number of patients came through here through the surge line, and we were very honored to be a part of that. So for us, it's been a growth experience. It's been a difficult experience. We've had to think about our employees. How do we keep them safe at a time where oftentimes the advice coming out of different authoritative bodies was changing by the day, if not the week, but we were able to adapt. And Jessica brought up the surge line, and I just want to call out what an amazing resource Health Current was, because I was on the call when we were talking about we're going to put in a bed tracking system at the state level, but we're going to integrate to every single individual institution on their own. And I was like, oh, this will take forever. I know IT, and even during COVID, that's going to take forever. And so I was able to connect with Melissa, and we were able to make that connection. And it showed the investment that we've made in Arizona in doing things differently, and then really, getting the yield from that investment. I'm just so proud of what Health Current's been able to do in partnership with the Arizona Department of Health Services. And so that emblemizes, again, not to toot our own horn, everybody's had a challenge with this terrible pandemic. But the collaboration that we've been able to do in Arizona, Honor Health is super excited to be a part of that. And I'm really, no matter what happens, I'm going to look back and say, this was a time when the wall between payer, between system, between geography came down, and we figured out, what do we need to do for our patients? That's why I went into healthcare. That's why you all went into healthcare. And so it's been the toughest year of my life. There's a lot more gray hair here than you can see, but it's also been exhilarating. So Nancy, thanks for letting me be here.
Oh, so another wonderful story. These stories are so great. They're very inspirational, I think, to all of us. And I loved your Pebble Rock story. We talked here about how we were in the very shallow end of the pool with telehealth. And then we quickly had to get to the deep end in 2 weeks and bring up over 200 providers. So I'm amazed that it happened, and it shows you, just the wonderful colleagues we have and everybody working together. So that's great. We've got questions already starting off. I'm going to I'll work from chat first. So we have a question from Dave at El Rio. Good job, Dave. How does the HIE support or compete with the Indian Health Service National Data Warehouse? That's
Thanks
for
for the question,
Steve.
Dave.
Yeah.
So the IHS National Data Warehouse is not currently set up with an HIE. So there technically is an RPMS, which is our resource patient management. It's our it's like the VA's Vista Imaging EHR that was given to us. So we have that system where all of our patient data goes there, but it's more of a backup and for large public health abilities. It's not currently launched as an HIE. Well, it technically is, but it doesn't work. And IHS is very open about that. So there is technically an RPMS HIE, but it's not acceptable. It doesn't function at all. So IHS has noted our success with HealthCurrent and the HIE, and we are actually a pilot site that will be testing a new HIE using the data warehouse and using RPMS data, and also tying into HealthCurrent to sort of network all AHS sites, all DoD sites, and all VA sites. That it wouldn't have happened if, for a lot of reasons, the pandemic, and also if we didn't participate with HIE and sort of show them the value and the benefit. I mean, I have countless stories of how we used it in great ways and how it was beneficial. Then I don't think there would have been movement on that, and I don't think they would have seen the return capabilities. And so that's actually new. We're piloting it in December. We're one of the first sites to start out. So
that was my next question. When's the pilot? So December is starting the pilot.
December, and it's literally 4 facilities are testing it out, and we're one of them.
That's great for all of us to know, particularly those of us that also work with tribal communities and know that system you mentioned. My staff said it doesn't work either. Yeah.
Right.
All right, let's go. We got some more questions here. Let's go back to Pedro. And Pedro, where were you in your health IT or your HIE journey pre-pandemic? You know, how was Adelante using HealthCurrent and that data before the pandemic, and then how has that changed for you all in the FQHC space?
And that's a great question, Nancy. And, as I think with many folks, we start off slowly and gradually begin to realize what the potential capacity is. And I remember, hearing about, our journey, at Adelante Healthcare in 2017. We signed up with HealthCurrent. In 2018, we started with some of the downloads and putting information into the system. And very quickly, as the pandemic hit, began a full transformation of really putting our information in and getting information and utilizing it, especially with the, as everybody has been talking about, the alerts, the COVID-19 alerts, which have been extremely beneficial to us in following up with our patients and just the community at large, right? And as we've been partnering with other organizations like Equality Health and Chicanos por la Causa and others in the state and the governor's office to do a lot of the COVID-19 testing. In many cases, they're not our patients, but we're still getting information, from the alerts and also, through those partnerships because of HealthCurrent and being able to follow up and do some of the contact tracing and case management components, with these individuals that are testing positive, and also the individuals just following up with individuals that are testing negative as well. So the connection to the HIE has been tremendous and definitely needed. And I think somebody mentioned earlier that the work that was done previously has really allowed us to benefit from this quick transition that needed to happen. To that end, I spoke with our staff, and we are ready to beta test. After we're completed with our interface with ACES, that we want to beta test what we can and be beneficial to the system, and making sure that we're looking at advanced directives and all of the components, that HealthCurrent is bringing to the table.
Excellent. So around the ACES data, we have our mandatory pediatric data feed on that. Maybe we'll ask Jessica what she thinks about doing that around adult vaccines. You know, our ability to maybe pass legislation that would have us putting adult vaccines into the ACES system, once again, capitalizing on Health Current. Jessica?
Yeah, thanks, Nancy. So ACES is the Arizona State Immunization Information System, and it's essentially a vaccine registry for those that aren't familiar. Currently in Arizona, it's required for pediatric vaccine administration for providers to report those doses administered into ACES, but it is not required reporting in most cases for adult vaccines. It's certainly an option that people can use, but it's not required. And so that provides a gap in the system because you can't easily follow up within ACES to determine if your patient has been vaccinated or needs a vaccine or needs a catch-up dose or anything like that if they're over the age of 18. And so there certainly is a gap there. I think policy changes are one aspect of that. Also working through the HIE through Health Current and their feeds to ACES to get better adult reporting into the system is another option. We're already connected for a lot of the pediatric providers and most of the vaccines for children providers, but getting more of the general primary care community connected into the system, as well as other immunizers who are serving adult populations, would be very helpful in that continuity, I think.
Yeah, as we think just about boosters, but also a future vaccine for COVID. So thanks, Pedro, for feeding that dialogue there. Let's go back to Jim on our health, Jim, and hear about health system pre-COVID as far as Health Current and the HIE. You know, your HIE is pre-COVID, and then we'll come back to the payer side. Go ahead, Jim.
Great. It's always good when there's two Dr. Jims on a panel, right? I mean, it's like the recipe for fun. So we've seen a tremendous value in the relationship with Health Current for a long period of time. And one of the ways that we've realized that is through, we have a large clinically integrated network called Innovation Care Partners that's attached to Honor Health. And the fascinating thing about that entity is there's about 300 different separate practices, one of which is Honor Health, and there's 299 specialists, primary care physicians. And so for a long time, I think when we last looked, there were 70 different EHRs across that environment. So while we use a particularly one brand of EHR within Honor Health, we knew from the beginning we were not going to be able to have a single platform across that world. So we actually invested in a community-wide HIE for that entity to help facilitate transferring information back and forth. And so early on, we were partners with Health Current to be able to pass appropriately the data both from our centers on to Health Current and then receive it back in. And that allows us to begin to build tools to integrate the HIE data from Health Current into the workflow. So whether it's building censuses of our physicians that are caring for people all over the valley, COVID was obviously a great example where we were able to, as different lab results became available, we could then normalize them because, as often happens in healthcare, everybody's got a different definition of negative and positive. So once we normalize all that data, that we could derive business rules around that, not just with lab results coming out of our own in-house testing, but SnoreQuest or anywhere that had been fed into the HIE. So I think for us, we've always seen that Health Current has been really a critical source of data, not just for Honor Health, but our larger sort of clinically integrated network community, over 4,000 physicians. And so it's going to be a long time, I think, before we have a single, I don't know if we're going to ever have a single clinical platform, across our state, certainly across our county. So Health Current and these types of technologies really are important bridges for us to communicate across the different landscapes of Maricopa County. Thanks, Nancy.
Nice, thank you. Let's go back over to the other Dr. Jim from the Blues. And then, so what was your world like in terms of your use of the health plan with Health Current before pandemic? Last time you were talking about telehealth and social determinants of health that we're really focusing in on that moving forward. But what about prior? Go ahead. Sorry to interrupt, Jim.
No problem, Nancy. Thank you. Me and Dr. Whitfill have been on many calls together, so we've had this Dr. Jim issue come up before. So I just want to.
Is there some identifier that I should already know?
No, we're used to this now, so we're good.
I thought if you had a nickname for each other.
So thank you for the question. So Blue Cross, we started our journey with the Health Information Exchange back in 2016, and really we're working closely, focusing mostly on the admission discharge transfer notifications. And these were things that were really servicing our utilization management and some of our case management decisions. And so we've been receiving these results through the portal and a data set. But when we really started to see this, explosion in COVID, we quickly realized that we needed to get to, our high risk members and set up new panels to really understand, the high moderate risk folks and be able to get to them quickly and proactively. So we've been able to use this in terms of being able to respond with putting resources in the right place, doing a lot of outreach, making sure that the care access is not compromised, making sure conditions are being managed. We're continuing to look what we can do in terms of creation of kind of a longitudinal medical record, and just really kind of improving the connectivity and the coordinations that we have with all of our clinical partners, because for healthcare to be sustainable long-term, we have to get better clinical outcomes. We have to drive waste out of the system, and the experience that we're creating for our consumers needs to be very personalized, and it needs to be very convenient to the members. So we see the HIE in the future as really being kind of an enabler, if you will, to bring the healthcare ecosystem together. And just like any ecosystem, unless all components of that ecosystem are healthy, no one component of that will be able to thrive. So we really continue to look as for HIE as that enabler moving forward. And one of those areas that I just would like to comment on in moving forward is really around interoperability. And, when we look at our provider directories, we look at the payer-to-payer data exchanges, we look at, very savvy consumers now that make empowered, smart decisions, and having patients be able to access that data to be able to make better medical decisions. We see this all as a key to that evolution moving forward.
Yeah. Sounds exciting. Sounds like that's where we need to be. I'm gonna move on to another question about, just really about how we have addressed the pandemic. A couple of you alluded to that, and one of the questions that came through was about just in light of everything we're hearing about uncertainty. Are we going to have another surge? What about the vaccine? What's going on? Are there pockets of clusters that we should be worrying about in our community? But how would you say, a couple more from a cheerleading perspective, that we in Arizona have risen to this? And I think that's the story we like to be able to tell, rather than listening to what people tell us they're seeing on social media here, or this, that, and the other. So what message would each of you, we'll start, who haven't we talked to for a while? We'll go back over to Stephen. What would you say, in just a sentence or two, about how Arizona has really had a silver lining, or really risen?
Yeah, I think a huge pat on the back to Health Current, to the state of Arizona and policymakers have been critical. And then the people that have been participating in the HIE, it's just going to snowball, and it's going to grow and become more integrated and integral to the system. And so I think that kudos needs to be given to them for setting us up for this excellent jumping off platform, because it's only going to become a bigger deal. Real quick, I would like to say before you asked about the 6-month journey of where we were pre-COVID, and IHS has a little bit of a different picture. We actually completely participated because of incentives from Access. So the Access American Indian Medical Home, actually, if you get to a tier 3 or 4, which is involvement with an HIE, there's monetary incentive. And so that was a huge motivator for us, and it worked. And it's been the dividends have been extremely valuable. So we had a slightly different perspective, but back to the question of 1 to 2 sentence sort of silver.
That's great. Thanks for sharing that. How about you, Pedro? What do you think about, in terms of highlight that you're really proud of Arizona's response to COVID?
Yeah, I echo the same that Steve mentioned, in regards to Health Current and their initiatives and how quickly they really stepped up to the plate to really get information out to the healthcare providers in a big way. But I would also, you mentioned, Steve, the political folks. I've been privy to being a part of meetings, from the governor's office, with some of the state representatives, and how they brought different groups together, from education, groups to the healthcare component, to other, stakeholders in the system, and really, having these quality meetings. I attend one on a weekly basis, with one of the health caucuses, and the Latino caucus, and others with the Quality Health and Chance La Causa. And Christina Corriere from the governor's office has been great in really providing resources, and just kind of what's happening day to day on a level. And so I would say, just what we have done, and collectively, from healthcare systems to other stakeholder systems, to us as a state, continuing to mask up, to do the things that we are doing to prevent. It's not over. I know that we have some fatigue, and we still need to continue and stay strong, so that we can continue to get past this. And I know that, Nancy, you alluded to potentially even what it could be if we had a second surge, and I think we all agree that something like that is coming. But the more that we do as a state, to come together and minimize what that looks like for us, the better off we're going to be.
Thank you. Jessica, I'm going to come back to you with another question that's in chat. So this is someone who is asking more information about the surge line. They're new in that understanding. Does this inter-facility transfer occur between all hospitals in the area, or just hospitals in the same system? Does it offer the option for a patient to be discharged early to home health or other lowers of care? So kind of how that care is triaged, I think.
Yeah, sure. I'm happy to talk more about the surge line. I actually think when we talk about bright spots in Arizona's response, collaboration is a huge deal, and the surge line would not be possible in any way without the collaboration across a whole host of healthcare systems and public health and the payers and the EMS transport agencies and the HIE all coming together to make this thing so successful. And I think Dr. Whitfill said we did in days what would typically take years. That's kind of the story of a lot of this response too. So for the surge line specifically, typically a transfer experience for a hospital might be that they need to transfer a patient to, say, a higher level of care, and they're calling all around to find a bed for that patient. It's taking hours. And early on, before we got hit very badly with that first wave here in Arizona, we were watching what was happening in places like New York and saying, we can't have this. We can't have a place in Arizona where, the northern region is completely bombarded and the central and southern regions have all this ample capacity, and patients and healthcare providers are just languishing in this one area. And so really worked with the healthcare system across the state to set up these protocols to make sure that we could get patients where they needed to be to alleviate a surge in one particular healthcare facility, and provide patient care at the level that patients needed. And so the way that the protocols work right now is that these patients are transferred, if eligible, to a facility within their region if possible. If there are no appropriate beds or care level in that particular region, then that patient does get transferred out of region to a different hospital, but it is system agnostic. And so that is such a highlight of this response, is that collaboration across systems. These are healthcare facilities that are often competitors in peacetime, if you will, that are working so collaboratively hand in hand together to make this work, to jointly develop protocols, to agree on how all of these things are going to happen. And there's an opportunity within the surge line to go to a higher level of care as well as to a lower level of care. And so you can get patients back to a lower level of care. And it has an arm in the surge line too for post-acute care as well. It's not an active transfer through the surge line for post-acute care, but we do, through the surge line, built out an additional visibility system. So if hospitals are looking to place patients at a skilled nursing facility or a step down long-term acute care, something like that, and we've got additional visibility where they can quick take a look at what's available in their region or area. And again, if it wasn't for the HIE kind of stepping in, because all of these hospital systems in the state have different bed availability tools too, we wouldn't be able to have that statewide framework in order to make this successful.
Yeah, that was hugely successful. I know in a meeting I had here in Tucson yesterday, everybody reported there were plenty of hospital beds, plenty of ICU beds right now, and also less need to intubate patients, being able to treat them as we've learned a lot about the disease and being able to get them out of the hospital in a more efficient, less timely way. So that felt all like good news for us right now, right? So let's see, who did I miss? Who did I not talk to about what they're most pleased with? I got kind of sidetracked in my head. I was thinking about all the community agencies, as Pedro was talking, that have stepped up to support healthcare systems with everything from food, transportation, delivering medications to some of our very fragile people who are afraid to come out of their home. Just all that community support has been really heartwarming here in Arizona as well. Dr. Jim from Blue Cross Blue Shield, we already heard from you. Who did I miss in that round? Must be the other Dr. Jim. Most proud?
Well, Nancy, I was going to just build on something Jessica had mentioned, and
Sure.
that was it's absolutely true that in quote peacetime, and I like that term, there's a lot of competition, particularly in Maricopa County, but I think Pima County has its own dynamics. But one of the reasons that we were able to come together, obviously there's Health Current, but there was a lot of transparency that was provided from Arizona to DHS and Health Current, and that data, when everybody can see where the transfers are going and it's fully visible and everybody sharing in the same burden, then it becomes a lot easier to get people to coordinate. Because again, I'm an optimistic person. I think people fundamentally want to do the right thing, but when there's not transparency of data, then sometimes you might, and rumors build and people generate can come to the wrong conclusion. And so I really want to celebrate the fact that Jessica and her team were able to sort of facilitate that level of transparency, and that really paved the way so that everyone could then participate on the even ground. And that's, I think, what's very different from Arizona from other states. Not being able, if you can't get that trust together, it's very hard to get competitive entities to start collaborating. So it's the trust was huge.
Valuable, very valuable to see that. And I know that Stephen had mentioned, and we have found that data from Department of Health Services to be hugely valuable in the dashboard, and that's been really helpful as well. So we have a lot, I think, to be proud of up there. And Health Current, we've repetitively mentioned, and we're going to say it one more time, and then we're going to start talking about telehealth. Just the data coming from Health Current, the alerts we've been able to get to follow up and track our most vulnerable patients has been great. I think partnerships between health plans have been really helpful as we all look at our shared risk around some of these patients and wondering what's going on with them. How can we, meet their needs while keeping them safe? So a lot of wonderful things. But I think probably the most questions that I hear here are, or in emails from colleagues across the country, is about telehealth. What do you believe about that? We heard Jim talk earlier about the surge in telehealth in the behavioral health space. I'm really curious about people's thoughts about, one, how did that transformation go? But also, what do you see in the future? In my head, I'm thinking about, I really want to collect some data on my patients who are having a lot of telehealth visits and see how their cost of care is, see how their health outcomes are. I'd really love to be able to have algorithms in place. One of my fear is that something happens to one of our patients and I go back and I see that they've had a bunch of telehealth visits, but we've not had them in, for a face-to-face. So just wondering, let's start with Pedro again. What's your telehealth experience at Adelante?
And so, as most of you know, we as well as many others had to quickly adapt and move to the telehealth environment, telephonic environment. And we were very fortunate that we had a platform in place, an EHR that had a telehealth system. So we currently use Auto. And that's been really good for our providers, much to what you were mentioning, Nancy, with bringing all of your providers on board. We also went through the same process. And what's interesting is telehealth has been great to help us through this transformation. But to your point, Nancy, that there's opportunities after. And you know, many of our patients definitely want to come back and see us in person. You know, we're definitely seeing that. And we had just a little, you know, data. We had over 1,200 extra visits this month as we began to open the doors a little bit more fully. And it's just a result of one, you know, our patients wanting to get seen and to be seen in person. And so we're definitely seeing that transformation as well currently. Currently, we're at about 35% utilization for telephonic visits, and we were in the high 20s up until a couple of weeks ago. We dropped down to about 15% utilization on the telehealth side, and that is, in my belief, a result of us opening the doors more to face-to-face visits. But we do see continuing in the future that telehealth is going to be a big part of our system continuing forward. You mentioned, you know, the need of many of our patients that can't make it into the office. I think it minimizes the need for when somebody has access to transportation issues and not able to come in. You know, we've seen a huge decrease in no-show rates as a result of telehealth and the opportunities. But to your point, Nancy, that we also have to be cognizant that people don't just get totally reliant on telehealth and being able to see patients face to face, so that we are following up with them. But as we move forward, we know that it's going to continue with us for many years to come. Innovation is going to be huge. Right now, we're looking at how do we gather, you know, information, you know, with many of our chronic patients in regards to high blood pressure, you know, diagnostics, and how do we get that information from somebody that's in their home. As you know, it can't just be somebody taking their own blood pressure and sending it to us. It definitely has to be some IT health platform.
So what kind of home monitoring devices do we build together in concert with our telehealth platforms as
Correct.
well?
Yes.
Yeah.
Yeah.
And let's go to Jim on our health. Are you seeing a lot of telehealth still? Are you seeing a decline, increase, like in some specialties? I know when I was talking to a hospital CEO here, he was telling me about how endocrinology is still running like 95% telehealth.
Thanks, Nancy. Yeah, absolutely. So number one, we are still seeing a fairly large demand for telehealth, as Pedro mentioned, kind of around that 25-30% of visits. I think that, you know, and I think we mentioned earlier, I'm board certified in clinical informatics, so I'm a believer in technology, but I also think that we're learning a lot better. There's challenges to telehealth. There's a number of our patients that don't like it. They miss being in front of their physician. I will tell you, when I'm in clinic, there are times when I'm frustrated trying to do the visit over video. I mean, it's better than nothing, but there are times when you can't put your hand on the patient's stomach, or you can't really tell, you know, how sick they are, and it's hard to put those into words. So I think that we're going to get better with being able to use a whole repertoire of tools. So I think of telehealth, and I break it up into a couple of pieces. There's synchronous telehealth, which is like what we're doing here today. We're having a video visit. I've got to schedule time. You've got to schedule time. We're together. And that's where we've taken the traditional office visit and we've replaced it with a digital equivalent. And that's certainly good, and that's working really well. And it's kind of gotten us through at least this piece, the initial surge of the pandemic. I think where we're going to see a lot of growth is actually what we call asynchronous telehealth, and that's how I communicate. I have children that range from the age of about 14 to 23, and they will never make time to talk to me. Like, they're not going to schedule time, but over the course of a day, we'll have a conversation. So there's a text that comes in, then 2 hours later, another text comes in. We're going back and forth like that, and so starting to see how in an asynchronous fashion, and there's a number of companies that have done this. You can begin to take a lot of low acuity events, make them very convenient for patients. So I think in the end, Nancy, we don't see. I'll put this, very diplomatically. The key that why we were able to do telehealth is there was two things. One is we were all sort of quarantined at home, and people couldn't get out, and we needed to deliver care. But there were also, it was incredibly, a lot of foresight on the payers to say, look, we're going to do parity for these types of things. That sort of opened the floodgates. And I think there was a mention in the chat of CMS announcing some new codes today. So obviously the reimbursement model will influence what we do with telehealth, but I think it's here to stay. Much of us, we're in a lot of value-based plans, so we see the benefit. And I think we'll learn that it's not perfect for everybody. It is not the end-all be-all. Again, as Pedro mentioned, we have a lot of our patients that when we ask the surveys, they're like, I want to be back. I want to sit in front of my nurse or my doctor. I don't want to see them on the iPhone or the Android device. So it's a great step forward. It will not be a universal solution.
So patient choice, in many cases, obviously for the good of their health. And then, Steve, let's just have you add a rural perspective, because obviously I saw a study that came out from Chiricahua down in Cochise County, where they, have mobile vans, they move around, a lot of driving for their patients. And their study of over 1,000 patients around telehealth just in the last quarter was hugely positive, mostly related to, not having to have that long drive. So how about at your place, your community?
Yeah, that's probably been one of the more interesting stories on the res during the pandemic. So in Apache County, where Chinle is located, 0.16 of the population, of the percent of the population, has access to 25 megabytes per second download speed. So that's like pretty standard internet broadband. It just doesn't exist out here. It's non-existent. So it was a pretty big challenge. So we did what we could in the environment that we had. For some of our more elderly, more high-risk patients, we actually adapted some tablets that went into the cellular network on the emergency. There's an emergency network called FirstNet that's designed for EMS providers. And so we use that to tap in on our tablets, and we would go visit patients that were significantly, them coming in was a risk proposition that we didn't want. Or if they were, quadriplegic, if they had some significant mobility disorder, then that was also really valuable for them. But as a sort of a population-wise response to telehealth, what we did is we actually made it internal, and we because there is no broadband outside of the campus of Chinle, so we would bring patients to the compound, to the campus, and we would do telehealth visits on the campus, where we would protect providers and protect patients, and also reduce our PPE consumption. At one time, we were dangerously low on our PPE, and I do feel very confident that our telehealth response really changed that formula, or that equation for us. So
it's great to hear that story. We just have a couple minutes left, and I want to go back lastly to Jim, the other Dr. Jim from Arizona Blue Cross Blue Shield. And just a short commentary on what do you think about payment in the future? I do think that we'll still see that parity in telehealth moving forward when we're outside of a public health emergency. And what do you think?
Yeah, I think Dr. Whitfill made a good point. How telehealth is used in the future is highly dependent on how it's reimbursed. There has been a lot of telehealth utilization since this all started. And as payers, we're looking through the data, understanding, what the impact of all this has been, and really looking to understand the best way to do that moving forward. So when you look at synchronous AV visits, those are obviously different than just a telephone call, for example. So as we will continue to vet the data, we'll look at what CMS is doing, we'll understand the intensity of those services, and the data will really help guide us on those decisions. And of course, we'll work with our payer partners. We're working with ARMA, and we'll make decisions that are guided, by strategy, by provider input, and what is best for the community moving forward.
Well, that answer was big and general.
There's no decision that has been made as of today on parity, Nancy. So
yeah,
I just say the data is evaluating how that should look, and there are many different types of modalities, like I said.
Yeah, very good. Thank you. And we do have just a little bit of time left. We thought we were down to our last 2 minutes, but we have a tiny little bit of time left. I'm going to open it up to the panel. What else would you like to share today that you were prepared to talk about that we didn't have the opportunity to talk about, or you felt like, boy, that facilitator cut me off, I had a lot more to say?
Nancy, Jim, I'll take a stab at it. I don't know what the future is going to bring. If I did, I would do much better in the stock market than I do today. But I am concerned about where we're going clinically, in the coming months. And so I would just, it was really heartwarming to me to see the CDC showcase what we did in Arizona, how we responded to this pandemic. And so I would just encourage everybody to remember we've done something really special here, and we've done something that I think is appropriate, and we've responded to the data, but we've done it in a way that meets the challenge, where that challenge existed. And so I know it's a fatiguing time. I know it's been a long time that we've been doing this, but I trust in Arizonans to be able to help get us through this next couple of months. It's going to be a challenge, but we've shown how to do it. And I just really want us to continue to be that beacon for the rest of the country, for people to say, wow, you all really, know how to collaborate, how to bring together different stakeholders, payers, partners, the people on this screen together. And so I would just encourage everyone, we've got this great opportunity to be a showcase for the rest of the country. And I'm proud to be a part of it. And I'd like us to continue to do that.
We're inspired. We're there with you. I think we forget we've been doing it for so long. When you talk, I think, yeah, I guess we have been doing this since March. I don't know. Jessica, go ahead.
Yeah, no, I just wanted to build on what Jim said. It's been foggy. Someone asked me at the end of the summer how my summer was, and I thought, did we have summer yet? It's just been going on for quite some time now. But the successes that we've had and the collaborations we've built and the groups that we've brought to the table, of course, there's more to be done. There are more groups to pull into the fold to make sure that we're being inclusive and responsive. But at the same time, I'm looking forward towards pandemic recovery and what that looks like and how we can leverage what we built here to improve the health of Arizonans moving forward across all these different groups. We, just from a data and electronic data standpoint and interoperability, have moved mountains. I know at the department, we've been working on onboarding laboratories to electronic laboratory reporting for over 10 years and have onboarded more labs in the last 6 months than we had in the 10 years prior. It was really remarkable. And so I think it shows that some of this stuff can be done if you've got the wherewithal to get it done. And we've demonstrated that there are more efficient ways when everyone's working together. And so I'm excited to see kind of what that looks like in the next phase, post-COVID being a pandemic and just becoming kind of a more endemic disease, and how we can leverage what we've built here.
Yeah, that's really exciting to think about. And I see that as a whole nother panel that we could convene, that recovery and what we've been able to do. Steve, final comments?
Yeah, so excellent comments from everyone.
Yeah,
it's been wonderful to be a part of the panel. Some of the things that I see that have been most valuable from the HIE perspective and our involvement with it are the automatic notifications. And I don't see why. I hope we look back someday on like fax machines as email is today to mail. We'll look at fax machines, and I don't see why patient notifications can't just automatically be sent to our health information department and be put into our record. And I think the HIE will be pretty critical to that. For real quick thing that we are actually building upon, we're looking to partner with a major organization for our telehealth, and records management is one of the more challenging components of that. The value is the other institution and us, we both participate with the HIE, so that's completely solved. So that problem is just off the table from the get-go, and we can focus our energy on other points. And I think you're going to see a lot of the value of just building on these points that the HIE and the silver linings from the pandemic will go forward. So.
Nice, very nice. Okay, back over to Pedro. Closing thoughts.
Yeah, Nancy, I just wanted to say that, I hope that we definitely continue in the future to continue to build the relationships and partnerships that we have exhibited, to this day. I believe that the HIE Health Current is going to be able to help us lead in a positive direction, and really looking at not just the health information that's needed, but also the social determinants of health and how we can capture that data and really move forward and being able to monetize that and really bring value to the system of, what kind of impact are we having on our community based on, looking at housing and food insecurities and workforce and so forth, and how it relates to the health of our communities in the future.
Yeah, yeah, those are the pieces that really become visible. I think our other Dr. Jim might have mentioned that earlier. With the pandemic, we've really seen the inequities and the folks who have really been hard hit with the pandemic. So, and last words go to you, Dr. Jim.
I would just like to say that, this has been a tremendous challenge for all of us, as a society, but specifically as we look at, healthcare and everybody involved in it, from the frontline healthcare workers to the different agencies that have been involved, to the payers, to just all the ancillary services, and really the HIE, everybody. And, it's very, challenging when these things happen, but how we respond to it, I think, says volumes about the type of people we are and why we're in this. And I have just seen so much, patient-centric, do the right thing, let's put everything aside, talk about what's right to do for the patients, for our society, and really come up with some collaborative, solutions that normally would take forever to get to. And it's just so, encouraging for me, because as we look at healthcare in the long term and the sustainability of healthcare, it's this same type of collaboration and work that I think needs to carry over to understand, we should be not competing against each other, but in a common goal for the sustainability of healthcare and for the better patient outcomes. And so I'm really encouraged by how everybody has responded to it. I think it's been fantastic. A lot of respectful listening, a lot of collaboration, and I really look forward to continuing that momentum moving forward.
That's wonderful. I have to give kudos to all the Health Current staff in putting together this amazing panel of the 5 of you, because it's been so inspirational to me. I'm really honored that the original facilitator backed out. I'm the substitute facilitator, but I'm delighted to be with you all and get to know you all a bit. I feel like I have some new colleagues across the state too. And thank you all for being with us this afternoon and sharing. I have made notes to myself of things I'd like to follow up with each of you on, so you may be hearing from me. And at this point in time, it's my honor and my pleasure to introduce, I think to many people, Morgan Honey, who is the CEO of the Colorado Regional HIE, and he is with us to help us close our afternoon. Morgan?